Entrepreneurs are someone who believe in making things happen. Next decade is going to be a golden period for Medtech startups.
皆さんこんにちは。世界のスタートアップ情報を発信するスタートアップバックパッカーです。今回はインドの研究員による革新的なスタートアップに会っていました。視力を使った傷や火傷用の包帯を提供しています。オフィスの横で視力を作る幼虫用の餌となる植物も栽培されてました。今回このインド起業家に直接どう研究員が起業に成功してビジネスで利益を出していったのか、そういった成功の秘訣をお伺いするのと、あとはインドの研究開発型のスタートアップの未来について伺ってきました。Now I'm with Vivek, CEO of FibroHeal.
I'm basically a pharmacy graduate. I did my bachelor's in pharmacy, went on to do my management and worked with few companies before bumping on the idea of where silk can heal a lot of wounds, and that's when I met my co-founder. The year was 2017 and we started walking the journey. Why did we choose silk? Because India is second largest producer of silk in the world, and because of the benefit it has, in terms of circular economy, natural product, biodegradable nature, and the ability to heal wounds faster, made it a perfect candidate to focus and build a medtech biotech company around it to create an impact. Here we are today, supplying to almost 1,000 hospitals in the country. What we started was to address one wound, which was burns. Today, we are a comprehensive company addressing all types and stages of wounds, including tissue management, infection, inflammation, moisture balance, epithelialization, and scar. So entire gamut we are focusing into. And as you spend more time into the market solving the real pain points and genuine problems, you get to know that these are the areas which we need, our research needs to be more strength. I'm backed by a strong team of both researchers, professionals, and people.
Were you confident that silk was actually going to be healing people's wounds when you started?
Good question.
I was wondering.
But this question is out there to all the entrepreneurs. Entrepreneurs are someone who believe in making things happen. When we started, they don't look at the problem; they see the one stage, one step forward. So my journey of entrepreneurship have been, I never looked that far. It's always one step at a time, and I always give this example to my team that when you are doing something new, it's exactly like you are having a candle in a jungle. You can only see one step at a time. Take that step, and the next step will be clear. We had thought that it will be an easy path. Of course, it was not an easy path, but we got all those approvals in 2020. And of course, Indian FDA also took time. We have to go via all the process of various animal model studies, human trials. So it took time, but yes. And I hadn't thought that far. I had thought that, you need to keep your head down, do the hard work, which we did. And ultimately, we are able to see the product, and that gives us tremendous happiness and satisfaction.
I see. So now that you have the product, now that you have the FDA, and now you're already providing this to hospitals already, right? What are your future goals for?
We have a lot of aspirations. We aspire to be one of the leading players in wound management space and tissue reconstruction space across the world. The aspiration is to export your products to various countries and ensure that what started in a lab and a small room is being used in various hospitals. It heals the wound and it offers the solution what it claims. So that is the biggest happiness, what we'll say.
It's interesting because, from my view, I always thought India having a lot of software companies like EdTech and all that, but is Medtech and biotech, is it being developed in India?
That's a good point what you highlighted. Biotech, medtech is one area where gestation period is little longer. Now the VCs, the community, the whole ecosystem has been coming forward to support it. And particularly for that, one of the government initiatives has also helped because they have formed a class 8 company called BIREC. So BIREC has supported and helped almost more than 3,000 startups. That has given a huge thrust. There is a lot of push from government to solve a lot of problems, and particularly COVID, showcase that lot of opportunities can be solved with biotech and medtech space. So people have learned to move away from just businesses as money, but to, solving genuine problems. That is what has come into. A lot of VCs are coming forward to support a lot of biotech because India, the biotech medtech space was not that matured initially. I see in last about 5 years, lot of medtech and biotech startups has come into play, solving some of the most genuine problems in the areas of stem cells, tissue regeneration, various tissue reconstruction, 3D, 4D printing, and various other kind of things. I definitely see the days are much more favorable for medtech and biotech startups. And also government has notified new medical device policy in India. So particularly from Indian perspective, next decade is going to be a golden period for medtech startups and medtech space.
You think the main reason is COVID?
One of the reasons is COVID. Also, with the success of biotech startups in US and some of the developed countries, because generally it takes time. In IT and other areas, all you need is a set of laptops or machines and, people will start working. But while in case of biotech, medtech, the capital investment initially is high. You need to have a ISO 13485 grade medical device facility. You need highly trained and qualified people. So those initial investment, many of the VCs, they find it tough. Now I see that there is a trend where people are understanding that yes, the biggest thing about life is life itself. So we need to bring products, bring solutions which serves to the life. The future investments will be much higher in this space.
I see. Very interesting. And more government initiatives, I guess?
More government initiatives. With particularly various initiatives of Make in India, ban the import, Make in India. That I think most of the countries are trying this out, and, developing local solutions to solve those genuine problems. I see that, will have an impact. And of course, the population of India. The growth of economy, the population of India, all those are contributing factors which will lead to the next boom.
So now that, biotech's more trending, do you think FibroHeal is actually gaining more support? And is it getting easier for you to run this business? Or?
That's a point. I don't know whether it becomes easier or you get used to it. But yes, definitely, the acceptance has been much higher. The first 10 customers are very difficult. The first 10 cases are much tougher compared to the next 10,000. So that's what we have realized, having treated more than 50,000 patients, present in more than 1,000 hospitals. Now it has become much more acceptable, easier for us to build the trust among the medical fraternity to use our range of products. One of the challenges what we face is generally if a startup is bringing a product, they get directly challenged in medtech space with leading giants like Johnson & Johnson and Smith & Nephews and 3Ms and Mondelez. Those companies, they have tons of data when they go to a surgeon. While for us, if I might go with a data of 500 patients, that's where it becomes crucial that, you have to demonstrate a product. So that the period is little longer because what a surgeon, he looks at that it's a new concept, it's a new startup, and you have to build that trust. So although you may go with the data of the trials and other things, he would like to see and experience it on his own. And before that, you need to have obtained all the necessary approvals. So once you are able to do that, then they take it. And once they see the concept, that yes, on bed number 12 or bed number 18, the patient wound is healed. It has shrunk drastically. Now I could see, then they are much more open to get to a product included in the formulary listing.
I was wondering because, you started this company 7 years ago, right? And
right.
That's when there was no trend for, medtech companies and all that. But you didn't think of doing any other business other than medtech or bio?
So I was in mid-20s and my other co-founder, Mr. Bharat, was in early 60s. Now what happened, there's the experienced guy, there's a youngster, that both energy came together. That is one of the important aspects, which people don't recognize, that you need to value experience and you need to value energy. And if you marry experience with energy, lot can be achieved. That is probably what happened because as a 25 guy, you need to have, burst of energies, and then, you couple of times you get beaten up and then you realize, fine, what I'm doing. But when you have experienced guys, it matters a lot. And also having a good team around. So frankly speaking, as I mentioned to you in 2017 when we started it, we haven't thought about this long. We just thought of the next day and the next day, and you will be able to reach it. So that's what
truly inspirational. So I guess having the mission and aspiring for this goal and having chemistry after.
Correct. I will give you some very simple example which you will find it interesting. We treat lot of complicated wounds. So for example, this is our broken cocoon, which is our starting material. We degum it and then come up with various solutions. Then we came the various formulations and other things. As we were working on, the team suggested that why don't we look at laparoscopy itself, and that gave birth to this product. So what happens once you are in that problem solving mode, you understand the pain point and you are committed. The ideas keep coming to you. If you would have asked me in 2017-18 that Vivek, will you launch a product for laparoscopy? I said, I don't know. But once you are committed to something, the vision keeps getting clear and the more number of people you meet, interact, that opens up a lot of things for you. And you will be surprised that now we have products, even for scars.
Yeah, that's why I believe you have multiple products because you understood the customer, you understood the problem. It's very impressive. It would be really nice if I can actually ask if you have any connections you'd be looking for or in Japan.
Frankly speaking, Everett, I would be looking for a lot of Japanese connect because Japan is known to be a pioneer in the area of silk and its various applications. Many places they use silkworm as a bioreactor to develop various. So I would be more than happy to associate with companies which are working in the area of non-textile biomaterial application of silk, or in the area of tissue reconstruction or Medtech space, I will be more than happy to connect. And personally, I have huge respect for Japan for the kind of work they do, the kind of trust, their product or their services that have. I would be more than happy to connect. You can connect to me on any social platform.
Great meeting you. Thank you so much, Vivek.
Thanks a lot.
いや、よかったです。今回の動画は本当に一歩一歩目の前の課題をですね、どんどん解決することでプロダクトが出来上がっていったというような本当に非常に素晴らしいお話でした。普通に考えてシルクでこういったことができるっていうのが多分やってみないと、実験してみないとわからないっていうのが本当に今研究員が起業する上で本当に難しいようなところだなと思う。一方で、そこで本当に耐えて、なんとかなるというか、お客さんの声を拾って、で、研究に反映してどんどん作っていくというような、そこの意識がですね、最終的に、適切な商品の開発につながったというようなスタートアップさんでした。あと、やっぱりインドはソフトウェアサービスで結構有名だったりするんですけど、本当に最近は VC とかスタートアップコミュニティも医療だとか、そういう研究員が事業を起こすみたいな、そういった分野の注目されているようで、今後、インドの方、本当にエンジニアリングとかもかなりできますし、人口規模もあるので、発展していく分野になるのかなと思うので、かなり目が離せないのかなと思います。それこそ、インド発で何か革新的な医療だとかが海外に輸出されるみたいな未来もそう遠くはないのかもしれません。こういった面白い海外スタートアップ情報をどんどん上げておりますので、ぜひチャンネル登録よろしくお願いします。ありがとうございました。